What's going on, everyone? Happy Friday. Happy Black Friday afternoon. I'm doing this Facebook Live off my mobile device, sitting behind my desktop here, my laptop plugged in. Defeats the purpose a little bit. I don't know. I just wanted to do a little different. We're about to head out to dinner. I'm sure you guys and gals probably do something fun on Black Friday as well. Stay home, nice meal after Thanksgiving, eat leftovers, go out to dinner. I don't know. We're going to dinner. We have some family here visiting. And I wanted to drop a quick Facebook Live. Remind you, Black Friday is going on. It's going to be tomorrow. It ends Sunday. All right. We had a lot of doctors that are reaching out via text, via email, and just wanted to let you know I'm here to answer questions. If you have any questions, you can shoot me an email. It's drtodd, Dr. Todd, at movenowu, like letter u.com. So Dr. Todd at movenowu.com. If you have any questions, you can reach out to me that way, and I can help you out. I can figure out with you pretty quick if this is going to work in your clinical model, or at least if it's going to work in what you have planned in the future, what you're trying to accomplish. What I'm trying to pull up here is an idea of the day 1 through day 5. I know a lot of practice manager groups talk about a day 1, day 2 system. In Move Now, we cover a 5-day system. Really, it's 4 days. The 5th day, we go through goals with a patient. I'm pulling this up on a screen over here so I can flip this around and show you in just a second. My other 2 monitors decided not to work right when I started this, so instead of working off of 4 monitors like I do at home, monitor junkie, I'm working off of 1. So give me just 1 second. I'll pull this up, and I'm going to show you a flow chart that we have inside of Move Now University. If you get to know me, you'll get to know that I like flowcharts. I do. I think it is the best way to map this stuff out. It's the easiest way to understand where we're going with things, is to see it bird's eye view flowchart. So let's see. I'm pulling this up. I'm going to show you what I'm looking at. I'll flip this around. I am searching through the documents, and we have it right. It's coming up. It's coming up right here. Okay. Right here. Move well implementation, big picture. Okay. So our day one, we do a tour, new patient consultation, and then an exam, x-ray. If they're acute, we adjust. That's what a little A is. And if they're not acute, we don't adjust. And then we have a checkout email or text message that we send them that goes to a page that we built. It's a ClickFunnels thing. We teach you how to do it. It's just a classier way of engaging your patient on day 1. So that's day 1. Basically, consult, exam, x-ray. Okay, pretty classical type of day 1. Definitely important language that needs to be communicated, and important things clinically to do. However, functional movement doesn't start until day 2. So day 2, we greet the patient. We go through, it's a broth video. So we show you how we do it. We give you a template of how to make a video that a patient watches, and it pre-frames a lot of what you're going to cover when you're going through x-ray. Now, common question, do you have to do x-ray to be part of Move Now? No. However, we do x-ray, we share how we do it. A lot of the doctors in the program do x-ray, so that's how we teach it. We have a bunch of doctors that don't do x-ray. They omit this part. But we do a broth video, brief report of findings video. Patient watches the video. It's about 10 to 12 minutes long. Then they come back into the adjusting room. We go through all the findings that we found on day 1. We adjust them, and then we give them an option of basically plan A or plan B. Plan A is short term. We're not going to plan anything long term. We're not going to map out clinical recommendations or do a movement assessment, or really try to dig any deeper to these issues that we found on the previous visit and that we know exist, but we're just going to go short-term route. Okay, so that's plan A. And in most cases, so I kind of take that back. In a lot of the cases, even if we do plan A, we'll still do a movement assessment, because at least we'll have some information where we can map out home care. So it's very, very rare that someone says they don't want to do anything. They just want to come in 3 or 4 visits and get out of pain. But in 99% of the cases, we're doing a movement assessment. That's called the Move Well 3. All right, so that's what MW3 means. Plan B is when they want us to map out recommendations and go through that on their next visit. We build a recommendation card. That goes to our billing department. They create the financial. That's day 2. Now, an important thing on day two is we run towards the danger, we run towards the fire, is what a mentor of mine used to tell me. Meaning, what are patients thinking on day 2 when you're going through a care plan and you're asking them, what do you want to do? Some people say, well, it depends. Depends on what? Well, how much it costs and how long it takes, right? Time and money. So we run towards the danger of that on day 2. We say, look, we just covered some things with you clinically. You have all these different health problems. You've been dealing with this for the last 10 years. You've gone to 10 different providers. No one has fixed this. You're convincing me that you are on board to get this fixed now. Now is different for a bunch of reasons you just told me. This is why you're so committed, because that's a process that we go through, which we teach. So then at that point we say, okay, well, let's address the 2 things that most people are wondering about. Your initial investment, because I don't call this a cost because it's an investment, because the difference between a cost and an investment is an investment, you get a return on your investment. Your return is going to be a huge improvement in your health. You're going to learn how to maintain this, what to do on your own, so that as we progressively see you less, which I'll map out and show you in a second, you will have the tools and the know-how of what to do to take care of yourself moving forward. Sound good? And they're on board. And then we'll also talk about the timeline. So we go through the timeline with them, how it's going to work typically over the next 12 weeks. If they're a child or a very mild adult, it might take less time, but a moderate to severe adult is typically 12 weeks. We talk about frequency, duration, all of that stuff. And then we also talk about what services we're going to do. And then we use that to basically justify and explain the charges for the program, their initial investment, the cost, how much it's going to cost. But we use the term investment because that's important to specify it's an investment. So we then go through that and we show them a range of what it is, and we see if there's any objections or if anything from there scares them away. We handle the objections, and in most cases people are saying, okay, thank you, all right, got it, sounds good. And then the next visit we're just going over the details. So their day 3, the 3rd visit, we're going over the financial. It's just the details. We're teaching them a little bit more, but now we have all their clinical recommendations gathered. We're going through that with them in person. And day 2, we still need to do the movement assessment. We need to get the data from the movement assessment to completely put together their clinical game plan, because we are prescribing various dysfunctional protocols to address anything from D1 to D8. So there could be 8 different dysfunctional protocols that we're going to flag. And then there's more specific little exercises that we might flag as well, depending on what's going on with the individual. We teach all that inside of Move Now, as far as how to do the movement assessment, how to understand what type of dysfunctions that they have, how to prescribe their protocols. So I'll flip this around. Then we go to day 3. So day 3, we greet, adjust. Now they watch froth videos. So patient interactive videos, pre-frame the PIV, patient interactive videos. They watch froth videos, which explain how things work in the clinic, segment, posture, movement. They watch that, doctor jumps in, goes over the financial after that, just really reconfirms what was done on day 2. So it's not a sales process, it's not uncomfortable, it's not pushy, it's not any of that. It's just specifics of what they said they already wanted from here, key. Then they commit and they either prepay, pre-schedule, or set up some sort of payment option, or let us know that they're going to get something arranged to do that on their next visit. They schedule their next visit, very important, day 4. Day 4 now is visit 1 of, let's say, 25, if we're doing a 25 visit care plan over 12 weeks. They check in, now exercise orientation. So there's a lot of specifics that happen here. This is where your exercise team is going to really bond with the patient, develop trust, rapport, and it's basically the exercise therapist's froth, so to speak. So they are setting them up for success, just like the doctor does that with the patient on day 3. The exercise therapist does this on day 4. They get onboarded to their online membership site, the 12-week transformation, which is going to help guide them through their care concurrently as they go through your care in the clinic. And they're also going to have access to an online exercise library that they're going to reference. They get adjusted. They do traction. Our office, we do traction. That's not a prerequisite for Move Now. However, home care is highly recommended for some level of curve correction where applicable. We talk about that in the program as well. We do traction because we do chiropractic biophysics in our clinic. You don't have to do that. A small percentage of our doctors do that. I'm just sharing how we do it. And then home care recommendations are covered on that day. They get their home care supplies. So get home mobility kit, Those are kits that we supply you with. It's part of the program. You get 10 of these kits, a starter kit when you join the program, and then you order these kits from us, and then that goes to the patient. It's an awesome program, let me tell you. Then day 5. Day 5 primarily is a goals process. They watch goals videos. Doctor sets goals with them, specifies, clarifies their home care, talks about some key things to make them successful with their care, and then they are adjusted, traction, and then they're off to the races. Now for these next several weeks, this is what they're doing for the next several weeks. Not going to cover all the specifics of that here. I just wanted to give you an idea of how we do our day 1 through day 5. Why that is so important. We invest the time with the patient early on in care so that they get better clinical results, they're clear on why they're there, and there's less maintenance and less things to do, and the systems just take them through from thereafter. They follow through with care, they get excellent results moving forward, and there's not a whole lot of effort to do later on other than focus on things clinically because you've set a solid foundation. They know what to expect, and they're on board. So that's that. Check out the Black Friday deal. Check out the link. We'll talk with you later. Have a good evening. See you in a couple of hours. See ya. Bye.